Have you seen those super scary headlines claiming that Medicare Part D premiums are jumping to over $179 in 2025? Well, relax, take a breath. Those headlines are definitely misleading. There are, however, some very big changes coming to Part D in 2025, and that's what we're going to talk about today. First and foremost, bye-bye donut hole. In the past, Medicare Part D had 4 stages: the deductible, the period of initial coverage, the coverage gap or donut hole, and catastrophic coverage. Now in 2025, things are going to be a little bit different. You'll still have your deductible, during which you have to pay for your prescriptions out of pocket, especially for those higher tier medications. Once you meet your deductible, you'll be in the initial coverage period. During this time, you'll be responsible for a copay or a coinsurance depending upon the tier of the medication. Now in the past, if you continued spending, you might reach the donut hole or coverage gap. At that point, your prescription drug costs would probably skyrocket to 25% of the drug's cost. In 2025, we are saying bye-bye to the donut hole, so you'll move directly from the initial coverage period into the catastrophic coverage phase. Usually during the donut hole, people would think that there was some type of error in their prescription drug cost bill. And unfortunately, we'd receive many panicked phone calls, and usually that wasn't the case. They were just in the donut hole. However, that being said, please don't take for granted that your medical bills are correct. It's estimated that somewhere around 80% of bills have some type of error in them. So it's very important that you stay informed. And of course, the best way to stay informed is to subscribe to this channel. So please do subscribe, give this video a like, and of course, if you have any questions, you can reach us in the comments below or at the number on the screen. All right, back to those 2025 updates. So as I said, in 2025, we're saying bye-bye to the donut hole, which means you would move directly into the catastrophic coverage phase. And there are more changes happening there. So in the past, if you did reach the catastrophic coverage phase, you'd now be responsible for 5% of your prescription drugs cost. And while that's certainly better than the 25% of the donut hole, for some specialty medications that could cost over $1,000, those copays and coinsurance were still rather significant. So in 2025, if you do reach the catastrophic coverage phase, you actually will have no cost-sharing responsibility for your medication. Your insurance carrier will take on the bills for the remainder of the calendar year. Also, the catastrophic coverage phase has dropped from $8,000 down to $2,000. So if your prescription drug spending exceeds $2,000, your plan will pay for your prescriptions for the rest of the calendar year. Now let's talk about premiums and that scary number that I threw at you at the beginning of the video, that $179 premium. Now hold your horses, because as I mentioned earlier, this is not exactly accurate. That $179 figure has to do with the average monthly bid for Part D. And it's true that yes, the average monthly bid has increased from $64.28 per month in 2024 all the way up to $179.45 per month in 2025. However, these bids are not actually what you would pay for your monthly premium. They don't have anything to do with the out-of-pocket costs for the consumer. And the reason for these drastic increases in the bid has to do with the drastic increases in the subsidies available. So while it's good to stay informed, you definitely don't need to know all the ins and outs of these subsidies and the national average bids. The numbers that you do need to know are what's coming next. So the Part D base beneficiary premium in 2025 is $36.74 per month. That is a 6% increase from the $34.70 per month in 2024. That 6% increase is a cap set by the Inflation Reduction Act. And without it, it's estimated that the national base beneficiary premium would have jumped to $55.98 per month. Now, bearing that in mind, the national base beneficiary premium is still not what you necessarily are going to pay on a monthly basis. However, it is important to know what the national base beneficiary premium is in case you're subject to that Part D late enrollment penalty. Even though the base beneficiary premium is capped at a 6% increase, it's likely that your plan is going to increase more than that. Now, the AEP, or annual enrollment period for Part D, doesn't begin until October 15th. And ordinarily, we would be able to preview those plans at this point. However, they're not available to us yet, but as soon as they're available to us, we'll make sure they're available to you. And even though we're still a little ways away from that AEP, if you are planning on working with a broker, please make sure and book your appointment now, because those slots tend to book up fast as we get closer to the AEP. There's more good news when it comes to the cost sharing of Part D, i.e. those copays and coinsurance. Part D plans must now offer structured payment plans. That means that you don't need to pay for it all at once. You can spread it out over the course of 30 days. There's also the manufacturer discount program. This is a voluntary program, but it does offer financial incentives on both sides. Under the discount program, participating manufacturers are required to provide discounts on their applicable drugs, brand drugs, biologics, and biosimilars, in the initial coverage phase and the catastrophic coverage phase of the Part D benefits. And let's talk about those 10 most expensive Medicare prescription drugs. For the first time ever, the federal government has been able to negotiate drug prices on behalf of Medicare. This has resulted in significantly decreased copays and coinsurance for the 10 most expensive prescription drugs. And it's estimated that somewhere around 1 in 7 adults actually struggle very much so to pay for their medications. We discussed these drugs in another video, but now we actually have the negotiated prices. And please forgive me, I'm definitely going to mess up the pronunciation of some of these. Feel free to correct me somehow phonetically in the comments below. So Eliquis has been negotiated down from $521 to $231. Xarelto has been negotiated down from $517 to $197. Januvia has been negotiated down from $527 all the way down to $113. That's very significant. Jardiance has been negotiated down from $573 to $197. Enbrel down from $7,106 to $2,355. We're getting into some of the really expensive ones. Imbruvica down from $14,934 down to $9,319. So you would definitely meet your catastrophic coverage there. Farxiga down from $556 to $178. Entresto down from $628 to $295. Stelara down from $13,836 all the way to $4,695. Again, catastrophic coverage. And Fiasp and Novolog down from $595 to $119. Feel free to pause on this screen if you want to see any of these more carefully. Also, beginning in 2025, third-party payments will count towards your out-of-pocket spending. That means that you could move from your deductible into your initial coverage phase more quickly, or even into that catastrophic coverage phase more quickly. Then there is the voluntary stabilization demonstration. I know that's quite a tongue twister. This is a voluntary program, but there are again financial incentives on both sides. So the first prong of this plan is that CMS will apply a $15 uniform discount across the board. The second prong is that these plans will be limited by a $35 increase year over year. So $15 less on monthly premiums, and your monthly premium can't go up more than $35 from one year to the next. So why would plans opt to participate in this? Well, it has to do with the reductions of risk corridors. If you're not familiar with that term, you don't really need to be. You just need to know that the government is basically willing to help minimize the risk that these plans are taking on. And in return, they'll offer lower premiums to you. Now, these changes are really only being applied to Part D plans, which are standalone prescription drug plans. They're not being applied to Medicare Advantage plans, but if you do want to learn more about Medicare Advantage plans, the pros and the cons, make sure to check out this video over here. Also, if you're a newbie to Medicare, make sure to check out our full Medicare playlist. If you have questions, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there's absolutely no charge for our services. Make sure to like and subscribe, and we'll see you next time.